Today's case study, Conceptualization and Diagnosis, examines the complex relationship between childhood victimization and the later perpetration of harm through the lens of intergenerational trauma. I'll be using the I Can Start process to evaluate our client, Jason. Utilizing the conceptual framework for case conceptualization, I can start. I have broken down each step as follows. I. Individual factors. Jason is a 38-year-old married Caucasian male who presents with emotional dysregulation, chronic anger, interpersonal conflict, and aggressive parenting behaviors. He reports a history of childhood physical and emotional abuse and currently struggles with symptoms of PTSD and depression. Jason demonstrates average intellectual functioning and maintains steady employment. Although he exhibits defensiveness when discussing his behavior, he possesses insight into the parallels between his childhood experiences and his current actions. His willingness to engage in counseling suggests potential readiness for change. C. Contextual assessment. Jason's difficulties occur within multiple interacting systems. His marital relationship is characterized by increasing conflict, emotional distance, and fear resulting from aggressive outbursts. Child protective services and legal involvement have heightened family stress. Occupational functioning remains stable, although Jason reports significant stress related to balancing work and family responsibilities. The broader social environment includes limited emotional support and few healthy models of conflict resolution. A. Assessment and diagnosis. Jason has no previous history of long-term psychotherapy. He attended several court-mandated anger management classes in his 20s, but reported little benefit because he viewed the problem as external rather than personal. He has never received trauma-focused treatment, despite extensive childhood victimization. Current assessment includes a clinical interview, mental status examination, ACE assessment, Level 1 cross-cutting symptom measure, PROMIS anger scale, and PTSD symptom screening. Jason's mental status exam. He appears his stated age and is appropriately groomed. He is alert, fully oriented, and cooperative, though somewhat guarded when discussing his childhood and aggressive behaviors. Speech is normal in rate and volume. His mood is frustrated and overwhelmed, with a constricted but congruent affect. Thought processes are logical and goal-directed. Thought content reflects guilt, shame, and minimization of some aggressive behaviors, with emerging insight into the connection between his childhood trauma and current actions. There is no evidence of hallucinations, delusions, or suicidal or homicidal ideation. Attention, memory, and concentration are intact. Insight and judgment are fair, but become impaired during periods of emotional distress, contributing to impulsive and aggressive behavior. His presentation is consistent with chronic trauma-related symptoms and emotional dysregulation. Assessment findings indicate chronic trauma symptoms, emotional dysregulation, and maladaptive interpersonal behaviors rooted in unresolved developmental trauma. Diagnostic impressions. Primary diagnoses. F43.10, post-traumatic stress disorder. Jason demonstrates symptoms related to chronic childhood trauma, including hypervigilance, emotional reactivity, intrusive memories, avoidance, and negative beliefs about self and others. F34.1, persistent depressive disorder, dysthymia. Chronic feelings of worthlessness, hopelessness, low self-esteem, and emotional numbness have persisted for several years. F60.89, other specified personality disorder, traits of borderline and antisocial personality features. The client exhibits emotional dysregulation, unstable relationships, impulsive anger, and occasional rationalization of harmful behaviors. Symptoms do not fully meet criteria for a specific personality disorder, but significantly impact functioning.
Z codes. Z62.810. Personal history of physical and sexual abuse in childhood. Significant childhood maltreatment contributing to current functioning. Z63.0. Relationship distress with spouse or intimate partner. Ongoing marital conflict and domestic violence concerns. Z62.820. Parent-child relational problem. difficulty maintaining healthy and emotionally attuned relationships with children. Z65.3, problems related to legal circumstances, court involvement related to domestic violence allegations.
N. Necessary level of care. At the time of evaluation, Jason does not require inpatient hospitalization because he denies suicidal ideation, homicidal intent, and psychotic symptoms. However, his aggressive behavior and family conflict indicate a need for structured outpatient services. Weekly individual psychotherapy, participation in a batterer intervention program, family therapy, and psychiatric consultation represent the most appropriate level of care. Ongoing risk assessment should occur throughout treatment.
S. Strengths. Despite significant challenges, Jason demonstrates numerous strengths that can support treatment. He maintains stable employment, expresses love and concern for his children, and acknowledges a desire to avoid repeating his father's behavior. He demonstrates perseverance, responsibility, and the capacity for self-reflection. His participation in counseling, despite feelings of shame and defensiveness, reflects motivation for personal growth. These strengths provide a foundation for building healthier coping strategies and relationships. T. Treatment approach. A trauma-informed, strengths-based, and integrative treatment approach is recommended for Jason. Treatment will focus on addressing the underlying developmental trauma that contributes to his current patterns of aggression, emotional dysregulation, and relationship difficulties, while simultaneously holding him accountable for his behaviors. CBT interventions will help Jason identify and challenge maladaptive beliefs learned during childhood, such as the ideas that power is maintained through intimidation, emotions should be suppressed, and conflict is resolved through aggression. DBT interventions will focus on emotional regulation, distress tolerance, mindfulness, and interpersonal effectiveness skills to reduce impulsive reactions and improve communication. From a trauma-informed perspective, treatment will explore the relationship between Jason's childhood victimization and his current behaviors, without excusing harmful actions. Family systems interventions will help identify intergenerational patterns of abuse and examine how these patterns continue to influence family relationships. Because the central issue involves the transmission of human-caused harm across generations, treatment will emphasize developing awareness of these patterns and creating alternative ways of relating to others. Art therapy interventions will support emotional expression and insight when verbal processing becomes difficult. Activities such as family legacy genograms, trauma timeline artwork, and the Child I Was, the Parent I Am self-portrait exercises will help Jason explore the connections between past experiences and present behavior. The overall treatment goal is to reduce aggressive behavior, improve emotional regulation, increase empathy, strengthen healthy relationships, and interrupt the intergenerational cycle of trauma and abuse.
A. Aims and objectives. The primary aim of treatment is to help Jason interrupt the cycle of human-caused harm by developing insight into the connection between his childhood experiences and current behaviors, while increasing accountability for his actions. Treatment will seek to promote emotional regulation, healthier interpersonal relationships, and the development of nonviolent coping strategies. Some specific objectives should include increased self-awareness by identifying connections between childhood abuse and current patterns of aggression, recognizing triggers that contribute to emotional dysregulation and harmful behaviors, to increase understanding of how learned behaviors from the family of origin influence current relationships. Next, to improve emotional regulation. Goals to develop skills to manage anger, frustration, and distress without aggression. Practice mindfulness and distress tolerance techniques during emotionally charged situations, and reduce impulsive reactions through the use of coping and grounding strategies. Another important objective should be to enhance accountability and empathy. Goals should include accepting responsibility for the impact of harmful behaviors on family members, increased empathy for the experiences of his spouse and children, to challenge cognitive distortions and justifications that support aggressive behavior. Additional goals should be to strengthen family relationships by improving communication skills within the family system, developing positive parenting practices that promote safety and emotional connection, and increasing trust and emotional attunement within marital and parent-child relationships. Processing developmental trauma.
by exploring unresolved feelings related to childhood abuse and neglect, reducing trauma-related shame, guilt, and negative self-beliefs, developing a coherent narrative that integrates past experiences without perpetuating harmful patterns, and finally, interrupting intergenerational transmission of trauma by identifying patterns of abuse and dysfunction across generations, developing alternative models of conflict resolution and relationship building, and establishing behaviors consistent with personal values rather than learned patterns of harm. These aims and objectives support the overarching treatment goal of helping Jason move from unconscious repetition of trauma-based behaviors toward intentional, healthy, and nonviolent ways of relating to others.
R. Research-based interventions. A multimodal, evidence-based treatment approach is recommended to address Jason's PTSD, depression, emotional dysregulation, and aggressive behaviors. The following interventions are recommended. Trauma-focused cognitive behavioral therapy helps process childhood trauma and challenge maladaptive beliefs about relationships, power, and conflict. Cognitive processing therapy addresses trauma-related guilt, shame, and distorted thinking that contribute to harmful behaviors. Dialectical behavior therapy teaches emotional regulation, distress tolerance, mindfulness, and interpersonal effectiveness to reduce anger and impulsive reactions. Family systems therapy examines intergenerational patterns of abuse and promotes healthier family relationships. Parent management training supports the development of positive parenting skills and nonviolent discipline strategies. Art and music therapy will facilitate emotional expression, self-awareness, trauma processing, and stress reduction through creative interventions. Psychoeducation increases understanding of trauma, social learning, and moral disengagement, helping Jason recognize and change harmful patterns. These interventions support the overall goal of breaking the cycle of intergenerational trauma by increasing accountability, emotional regulation, empathy, and healthy relationship skills.
T. Therapeutic support services. Jason would benefit from a range of therapeutic support services to reinforce treatment goals and promote long-term success. Participation in a batterer intervention program can provide accountability and education regarding healthy relationships and nonviolent conflict resolution. Family therapy can strengthen communication and repair relationships with his spouse and children. A psychiatric evaluation may be helpful to assess the need for medication to address symptoms of PTSD, depression, anxiety, or sleep disturbances. Additional supports may include parenting education programs, community support groups, and case management services if legal or family system needs arise. Collaboration among mental health professionals, medical providers, and family members can create a comprehensive support network that promotes healing and reduces the likelihood of continued harmful behaviors. These services complement individual therapy by providing practical skills, ongoing support, and accountability, while helping Jason build healthier relationships and interrupt the intergenerational cycle of trauma and abuse.
In conclusion, Jason's case demonstrates how human-caused harm frequently originates in prior experiences of victimization, attachment disruption, and learned relational patterns. His story reflects a painful paradox. Those who suffer trauma may later become sources of trauma for others. Through the lenses of trauma theory, social learning theory, and moral disengagement, this case illustrates how cycles of harm are maintained across generations. The goal of treatment is not only symptom reduction, but also interruption of the transmission of trauma. By fostering accountability, self-awareness, emotional regulation, and empathy, counseling can help individuals transform inherited patterns of harm into opportunities for healing. Thank you for watching, and I look forward to your feedback and personal perspective.